So you guys already know, the COVID-19 pandemic continues to evolve complicatedly, killing hundreds of thousands of people, causing heavy socio-economic impacts, and posing great challenges to all countries. However, in Vietnam, the government has basically controlled the COVID-19 pandemic well, so it has entered a new normal state. New normal is a term of the state focusing on economic recovery and development while not being subjective in effective pandemic prevention and control. In a new normal period, Prime Minister Nguyễn Phúc said that, more than ever, countries need to strengthen international solidarity, mobilize resources, and effectively respond to the pandemic. So I'm going to express the bright sides of the new normal, along with efforts to handle the severe consequences of the pandemic. Countries need to have a post-COVID-19 development plan, support business to restore production, and be associated with ensuring social security for people. Even though the vaccine is available now, there will continue to be a risk of infection even as people get back to work, school, and a more normal life. Therefore, each person needs to continue to practice protective measures, such as wearing a mask in public, keeping a safe distance from people around, covering mouth and nose when coughing and sneezing, and washing hands frequently. Those requirements helped people to raise awareness about the importance of health. As people are still encouraged to work from home, they are more cautious about networking. People only use secure connections for online transactions and deal with reputable websites only. Besides, domestic or private enterprise, medical facilities, schools also development plans to ensure students and employees' safety. Each place will have mandatory self-assessment for all employees and students of possible coronavirus symptoms, isolation at home, and testing if needed for anyone who has symptoms. Employees don't return to work until they are cleared by the health department. All people will be required to wear masks when going to work. Social distancing in all areas, except during medical care activities when appropriate personal protective equipment is worn. In addition, hospitals especially need strict hygiene of all facilities, including in clinics, surgeries, and procedures before and after each patient, to keep other patients and staff safe. These measures have avoid great risk of infection of coronavirus again. That is what our country has done to have Vietnam become one of the many countries with low infection and death rates. In some places, the number of coronavirus cases drop. Some prevention measures are being lifted, but this doesn't mean we should go back to the old normal. Without being vigilant and protecting ourselves and others, the number of coronavirus cases could increase again.